Now I would like to talk to you about the diseases that occur related to epithelial barrier theory. We identified 68 diseases recently, and as soon as we published the paper, we saw that there are more diseases to add, and we are preparing an update. What were the criteria we looked at in the diseases that are linked to epithelial barrier theory? The first criteria we selected was increased prevalence of the disease after 1960s or after 2000s, which is not affected with the changing method of diagnosis. So in 1980s, when we were doing endoscopies, the same method is used for the diagnosis of eosinophilic esophagitis, and then the disease was not detected at that time in 1980s. And when we come to 2020s, we are seeing so many eosinophilic esophagitis cases with the same method. It is like that, or skin prick test, or diagnosis of a psychiatric condition. Epithelial barrier defect and epithelitis is the second criteria. Here we have major cytokines, IL-1, IL-25, IL-33, TSLP, and many chemokines released. And we can detect this in the tissues or at the place in the circulation also, or tissue fluids that are coming out of the tissues. And microbial dysbiosis is very important. And we are seeing in these affected tissues loss of commensal bacteria and colonization of opportunistic pathogens. This is quite important and interesting. And why do we lose our commensals? That's a very important function they have. And we have around 1 kilo of commensal bacteria in our gut. And they should show a diversity of more than 4,000 species, but their diversity is decreasing. So this is part of the biodiversity hypothesis. And then the fourth criteria is something very interesting. As clinicians, you can see this a lot, because different and practically irrelevant diseases that fulfill these criteria appear in multimorbidities. So we are also facing a comorbidity, a multimorbidity pandemics at the moment. Many diseases are taking place together. And then circulating microinflammation is a new concept we are bringing to the area. When the epithelial barrier is leaky, we are seeing that these people have inflammation in their circulation, although they apparently are healthy. And when we select fully healthy people, about 1/3 have epithelial barrier leakiness and leakiness of the cytokines and chemokines to their circulation. That may prone these individuals to develop certain diseases. And the studies are going on in this area. So this paper was published a few months ago. Nasun and Ismail Öğür are the first co-authors, and we have worldwide top scientists in the area of gastroenterology, psychiatry, and gynecology, and these are many key people who worked on these diseases and who are continuously seeing these patients. It's a consensus paper. And we have here the list of 68 diseases associated with the epithelial barrier theory and associated with our 5 criteria. In the skin diseases, we have atopic dermatitis, alopecia, contact dermatitis, chronic urticaria, psoriasis, rosacea, pemphigus vulgaris, bullous pemphigoid, hidradenitis suppurativa, asthma in airways, allergic rhinitis, chronic rhinosinusitis, COPD, idiopathic pulmonary fibrosis, non-allergic rhinitis with eosinophilia, sarcoidosis, pulmonary hypertension, cystic fibrosis. In digestive tract, we have a big list: eosinophilic esophagitis, periodontitis, gastroesophageal reflux disease, Barrett's esophagus, food allergy, food protein-induced enterocolitis syndrome, inflammatory bowel disease, celiac disease, irritable bowel syndrome, colonic diverticulosis, microscopic colitis. In neuropsychiatric group, Alzheimer's disease, Parkinson's disease, autism spectrum disorders, stress-related psychiatric disorders, chronic depression, ischemic stroke, migraine, multiple sclerosis, amyotrophic lateral sclerosis. And there is a big autoimmune group, Graves' disease, Hashimoto's thyroiditis, systemic lupus, ankylosing spondylitis, granulomatous with cholangitis, autoimmune hepatitis, Behçet syndrome, rheumatoid arthritis, osteoarthritis, IgA nephropathy, diabetes, obesity, metabolic dysfunction associated steatotic liver disease, and liver cirrhosis. In ocular diseases, ocular allergy, allergic conjunctivitis, age-related macular degeneration, dry eye, glaucoma, uveitis, and other groups which are not classified, end-stage renal disease, heart failure, myocarditis, osteoporosis, anemia, hemolytic uremic syndrome, sepsis, severe COVID-19, cardiovascular diseases, polycystic ovary syndrome. So I stop here, just think about these diseases and think how to handle these diseases with the perspective of epithelial barrier therapy. Thank you.